Very good morning, every student. And again, today we will discuss on the Carroll Dunham. I think already you have obtained a book from library or from purchase from others shop. The Carroll Dunham's Homoeopathy, the Science of Therapeutics. Very good book and good philosophy over there. And I told you yesterday, last class, that 6 chapters are included in your syllabus. I will discuss one by one all the chapters. Now, I have told you the first topic, the science of therapeutics. It has some sub-chapters. The first chapters include known as the homeopathy, the science of therapeutics. I've told you what is the object of writing these chapters, this book, yesterday. So sorry, in the last class about the object. The object of this paper, the first to discuss about the nature and condition, possibility of science, to examine the methods of which science may be most successful. He has tried to discuss about whether homeopathy is science or not. The art of practice is science or not. So the object of the paper. And in this topic, in this paragraph, in this topic, or in this chapter, it comprising of 12 paragraphs. If you obtain this book, you will go through one by line, 12 paragraphs. And each paragraph is very much important. The first paragraph, he has mentioned about the object. Second paragraph is also of the object, the purpose and object. And now fourth paragraph, he has given the definitions of the therapeutics. Therapeutics is the art and science of application, skillful applications of medicine, knowledge of medicines in your daily practice. That is the therapeutics. It is the art of healing. Homeopathy is an art of healing. Art, I think you know, art means it is the skillful applications of the scientific knowledge. Art and arts is quite different. Bachelor of Arts, BA, Master of Arts, MA, that is the humanities, quite different. Art, A-R-T, art. The therapeutics, the etymological meaning, the science of curing the disease. It would seem to comprise the entire function of the physician. When you will attend to clinics, what to do and what not to do. These guidelines are very much important. Being a doctors, budding doctors, तुम कैसे अप्रोच करेगा, कैसे तुम पेशेंट को देखेगा, किस तरीका से a practical oriented topic. Entire book is totally practical oriented, and it is evident on slight consideration the medical man in the general practice bring into the equation of great variety of scientific knowledge of the subject and to make comprehension of it. जैसे आपको, you are just final year student, already you have obtained all the knowledges of anatomy, physiology, pathology, FMT, gynecology, surgery, and practice of medicine, as well as the community medicines. You have obtained. Whether you are now going to be a doctor after getting the registration number. But the very first aphorism of the organ, Hahnemann reminded to the physician's high and only mission is to restore the sick to health, to cure, as it is termed. Keep in mind, Hahnemann, for whom wrote this book, for the first BHMS, he never thought that one time in the world, the homeopathy graduation, post-graduation course will start. He never thought, but he wrote this book particular to the Diden School of Medicines. Already they are physicians. Are you physician? No, you are the final year student. So from the very beginning in the first year, the organ of medicine included, just they will acquire the knowledge of anatomy, physiology, and pharmacy or biochemistry. So this is not suffice to say that he is a complete doctor, but you are your final year student, you are a complete doctor. So at this point of time, you have acquired all the scientific knowledge in the different subjects, and all the knowledge will come into effect in your clinical practice, starting from the anatomy to community medicines, all the knowledges. Mind that whenever you have passed the first BHM examination, you forget no. It will come into in practice, daily practice, the anatomy, physiology, pathology, FMT, all the skillful application of the scientific knowledge in the clinical practice is known as the therapeutics. And in addition to that, being a homeopath, we need to know the knowledge of medicine. The knowledge of medicine, if the physician clearly perceives what is to be cured in diseases, that is to say, each individual case of disease, knowledge of medicine and the indications and the indication, and that is when is that indication. What does mean the indication means? The knowledge of medicinal power here mentions. The knowledge of medicinal power. Why he has mentioned the knowledge of medicinal power, not the knowledge of medicines? Because of that, in homeopathy, we prove the drugs in certain potencies. That is the 30 potencies recommended by Master Hahnemann. Do you think, being a student of the chemistry or physics from your 12th class standard or some of your BSc, that the 30 potency consists any medicinal quantity or a chemical nature? No. But what it contains? Some power within it after potentization. That power do not need mass. Power do not require any mass. But when there is no mass, what is that? That is something that is such a qualitative power. That qualitative power, it is Hahnemann express is the dynamic power. So if the physician clearly perceives the knowledge of disease indication, and if he clearly perceives what is the curative power of medicines, today, after completion of BHMS, first BHMS, or whether you are the budding doctors, you are not quite enough to identify what is the knowledge of medicinal power and indications. So until and unless you acquire this knowledge and apply it in your clinical practice by the way of scientific knowledge and art and science of scientific knowledge, that is the therapeutics. So if you want to take the definitions of it, you go through the 4th paragraph of this one. Dunham has given a short definition, and thereafter he has mentioned the therapeutics is subordinate to hygiene. In aphorism 4, what he wanted to say, Hahnemann wanted to say that he is likewise a preserver of health if he knows the things that derange the health and cause the disease and how to remove them from person's health. That person's health, that means the community-based approach. So being a physician, in your clinical practice, first you have to identify whether the patient is suffering from some disease, whether this one caused by anything related to the hygiene, anything related to that cause that can be removable, that you have to identify. So sometimes what happens, therapeutics is subordinate to hygiene. So there is no need of application of medicine. Apart from that, when there is an errors in the form of their diets, habits, habitats, and others, if you remove it, if you correct it, the patient will automatically be get rid of his sufferings. Cure and get rid of is quite different. But when, in spite of removal of such, if the patient suffers, then question of applications of therapy, the question of application of the medicines. Hahnemann classified the disease, the chronic disease. First, he classified the disease into two forms, acute disease and chronic disease. Acute disease, I know that you know there is two types. You know the three types, but actually acute disease are two types. One is the individual type, other is the collective type. The collective type is again classified into sporadic and epidemic. If you go through the aphorism number 72, the clear definitions he has given, you please open the organ of medicine, you find it. Likewise, the sentence has been started from the sporadic and epidemic. जैसे एक sporadic है, वैसे माफिक दूसरा एक disease होता है, उसको epidemic कहा जाता है. Therefore, he has classified into collective. Again, in the chronic disease, he has classified into three types: artificial chronic disease, inappropriately named chronic disease, and true natural chronic disease. Artificial chronic disease, he has given so many examples. I think you are a student of final year, you know that what are the artificial chronic disease. Going to that, what patient suffers, how patient suffers, that are to be identified. Next, inappropriately named chronic disease. Sir, what is inappropriately named chronic disease? Actually, in the markedly available notebooks, you'll find that notebooks mentioned as a pseudo-chronic disease. Hahnemann never used any such term as pseudo-chronic disease in organ medicine. Hahnemann stated, you please open aphorism 77, that is the inappropriately chronic disease. Mind that in the very first sentence, he started with the inappropriate chronic disease, that patient may incur, patient may suffer due to some avoidable circumstances. So in a such case, when there is an inappropriately named chronic disease, you will find by case taking, and first you identify that you have to remove it. You have to remove it. Patient should be advised the removal of such thing. In spite of that, if the patient suffers, so there must be something else apart from that avoidable noxious influences, that is due to miasm. So that miasmatic application, miasmatic consideration of the disease, when it comes, when you find, first if you have to find, if there is a cause, anything cause that is removable, that removable cause is known as manifest exciting cause. Manifest exciting cause, that manifest aphorism number 7, you will find manifest exciting cause or maintaining cause. That manifest exciting cause, I have told you last day, that visible, perceptible, palpable, तुम इसको रिमूव कर सकता है. पेशेंट को एडवाइस करने वो रिमूव कर देगा ऑटोमेटिकली. पेशेंट will get rid of her his sufferings. So, ये जो hygienic cause is come into the manifest exciting cause or maintaining cause. The manifest exciting cause or maintaining cause never produce diseases. They promotes disease, maintains disease. हम तुमको एग्जाम्पल देके कैरोल डनहम यहाँ पे बहुत सारे एग्जाम्पल देके धीरे धीरे उसको समझा दिया कौन सा मैनिफेस्ट एक्साइटिंग कॉज होता है तुमको रिमूव कर सकता है. प्रैक्टिस लाइफ को तुमको ध्यान देने चाहिए, किसका तुम हटाने चाहिए. ये ऑटोमेटिकली द पेशेंट विल गेट रिड ऑफ. मेडिसिन का कोई जरूरत नहीं है, थेराप्यूटिक से कोई जरूरत नहीं है. सो मैनिफेस्ट एक्साइटिंग कॉज एंड मेंटेनिंग कॉज नेवर प्रोड्यूस डिजीज, promotes disease, maintains disease. But who produces disease? Disease कौन तैयार करता है? According to homeopathy, according to our philosophy, according to the chronic disease, मायाजिम तैयार करता है, शोरा syphilis psychosis. My students, I know that you have some very hazy ideas about the miasm, that how miasm transmits generation to generations. It needs discussion. In long run, when I will take class, I will give you the clear idea of miasms. Miasm कैसे मनुष्य जाति में thousands, millions and thousands years, 81 aphorismic open, have been tortured by that miasmatic impressions. Miasmatic impressions. That impression is carried by from one family to other families. Genetic impressions. In the modern language, you can say. Hahnemann, when he told about the miasms, that impressions at that time, there is no question of gene, there is no question of hereditary. These were not discovered by Mendel or Hargobind Khorana. Naturally, philosopher like Hahnemann, true sense, it is the dynamic impressions. It is a separate subject I will discuss later on. Now, today he has given 7 examples wherein he tried to prove that the high genetic cause, the cause arising out of our manifest extending cause, does not require any medicine, therapeutics. Analyzed by series of cases. First case he has mentioned. Please open the book, Carroll Dunham. I have told you, already I have donated one book at your library. A library has already 3 or 4 books. Contact with the Dange sir, you collect yourself and Xerox the 6 chapters. Make it Xerox. If possible, purchase the book, 300 or 400 cost by Amazon, or procure from your Shankar Dwara में जो तुम्हारा book shop है वहां पे purchase कर लो. तो Carroll Dunham the first case दिया है, वो जो paragraph number 5 में है, देखो. Physician that he got a patient with a great anguish in the precordial region. कोई patient आया है, Dunham जो example दिया है, that precordial region is a very endangered to life. That is imminent death, as if. The prognosis demanded because of that. Why? What is the real cause of the precordial region pain? You have to find out by case taking, and that is a matter of great importance. You have to know the pathological knowledge. What is precordial region might be? Is it ischemia? It is myocardial infarction, that precordial region. So the knowledge of pathology is very important for it. Now, after evaluation, you will find with this, if it be the fatal case, the function of the physician ends. If it is not fatal case, you will give one medicine, no recovery. Either Crataegus or Calcarea ars or any other medicine, digitalis, or any other medicine as per your syllabus or from repertory, whatever you do, some medicine. But in spite of that, there is no relief. If it is fatal, this will not give you time. First attack, second attack, third attack, gone, or first attack sometimes. What is the scope? You have to keep the patient in this point of time. तुम patient को तुम्हारा पास रखेगा कि वो कोई एलोपैथिक नर्सिंग होम में ट्रांसफर कर देगा, जहां पे वेंटिलेटर है, जहां पे आईसीयू है. हमारा अंतर्भारती में आईसीयू नहीं, अभी नहीं है. ऐसे कुछ आईसीयू में दे देगा तो क्लियर हो जाएगा, ऑब्जर्वेशन में क्लियर हो जाता है कभी कभी. But on the question, you have to find out whether you will apply the medicine or not apply the medicine. But after find that last day or last few days, he got some worries and anxieties, continually loss of sleeps due to sudden loss of her friends, due to certain loss of his very good friends, his parents, one of the member of the parent. And owing to that, suffering from that anguishness, suffering from the So you have to, कब से हो रहा है डॉक्टर साहब? देखिए ना, ये तो बहुत, मैं आपको कैसे बताएगा, बताने का अपने सिचुएशन नहीं है. You please do something. You are doing practice in the rural areas or Nagpur at areas. Some patient has been brought to your chamber with a left pain in the left chest, the precordial region, severe pain. Patient cannot speak, will not give the time enough. So that anguishness, if it is not properly monitoring, due to sudden loss of any things, that might be due to money, loss of business, bad effects of love, anything loss, that might cause the precordial region pain. And you have to counsel the patient, and if possible, we have to give some medicines. It actually does not require in medicines. Just counseling, the physician regards to the cause, that cause remove. In spite of that, if the patient suffers, then the question of applications of medicines. First, you have to counseling it by the way of giving some advices to remove the worries and anxieties. Physician clearly perceives, that perceives means two means. Comprehend in mind, that perceives is sympathetic, other is the empathetic. What do you mean by sympathy and empathy? Sympathy means a rich student, a student of Antarbharti from a rich family donates few amount of money to a poor beggar, others. That is the sympathy. Out of sympathy, you donate something to beggars or your friends or others. But what is empathy? कोई poor, कोई गरीब स्टूडेंट किसी को डोनेट किया है, that is called the empathy. Empathy means the projection of one personality to other personality to feel the sufferings of the others. The student, the poor student, the student who belongs to poor family, he knows that what is the sufferings due to the want of money or want of anything. Therefore, that poor student belong to a poor family donated or donates few amount of money or foods to his friends or poor beggars. That is called the empathy. Actually, homeopath should be an empathetic person, should feel his patients by empathy. Hahnemann told in the drug proving chapter that physician is the best prover. Why? He has mentioned, I think already have. Why is best prover? Because he who feels the application of medicines due to drug proving, if he proved or she proved and feels the sufferings as produced by belladonna, sufferings as produced by the arsenic, sufferings as produced by the sulfur, sufferings as produced by the nasbhumika, then you will feel a person, a doctor who suffered in his early life by the carbuncle, then he knows or she knows what is the pain of the carbuncle. Therefore, in practice, true sense, our approach should be empathetic, not the sympathetic. That empathy, again I repeat, means projection of one personality to other personality to feel the sufferings of the others. Therefore, Central Council of Homeopathy and National Council of Homeopathy has included the drug proving chapter in internship course. I do not know how many colleges are performing that, but at least you should prove one drug on your life and the field of the sufferings of that medicine as produced during the drug proving. Then you will be very expert of it. So in this case, he has tried to explain that sometimes the therapeutics do not come into play only by counseling, by way of talking. A case taking is well taken. A well taken case is half cured. Why? A well taken case is half cured because of that. Only in homeopathic case taking, we take exhaustively the mental symptoms, physical symptom others, no any other pathy, even in modern pathy. The modern pathy, they are very much concerned with the diagnosis of the case. That what is the diagnosis by the technical procedures, by any instrumental way, or by anything. That part, their job is finished. Their job is finished. And thereafter, they will find out any medicines that in the form of antipathy or then in the form of any other thing, in the modern days, antibiotics and others. A patient is suffering from corona. That corona, when they will diagnose it, one or two medicine they have. But homeopath, the corona, that might be due to arsenic, that might be to gelsemium, that might be due to any other medicine who has to produce, who has the power to produce that individualistic features. That corona, commonly we are finding the arsenic has come because of that mental symptom and others, worries and anxieties and fears and anxieties, the fear of death and others, physical and mental restlessness, that arsenic most of the cases. But Bryannia, or so many cases have been treated by the Bryannia. So many cases have been treated by the Rastax. So many cases have been treated by the Epitorium perfilium. So many cases with the Ras venereata. So many cases between any other medicines. So this is the part, important thing by which we can, the disease indications. That indication does not mean the diagnosis. The indication means that on the basis of individualistic features or characteristic features of the patient of the same disease, X will suffer, produce another symptom, Y will suffer the same disease will produce addition. In a 3 or 4 cases of malaria, you will find it might be styrinomers, it might be arsenic, or any other medicine. On that basis, that is the indication by which we can isolate the patient, individualize the patients. So in case number 1, we have to individualize what is the cause of the anxiousness. That anxiousness, after case analysis are talking, when we'll get that means what are the sources, the patient himself or those around him, and the observation of the physician. 3 sources by which can elaborate, by which can identify the individualistic features. Patient himself, when he will suffer, that is a subjective symptoms. This is very much important for us. But a condition might be the patient cannot explain his suffering, the anguish and others. At that point of time, we have to take the help of the surrounding him, those who are surrounding him. That surrounding him here or her, they must be well-wisher. They must be well-wisher. Understand? Sometimes surrounding people may not be well-wishers. Even wife may not be well-wisher of husband. Husband may not be well-wisher of wife. Similarly, a friend may not be. You are दोनों एक साथ में रहता है, चारों एक साथ में रहता है, पांचों एक साथ में एक ही हॉस्टल में रहता है, लेकिन तुम्हारा good relation नहीं है. You are enemies relation in mentally. So actually, Hahnemann wanted to say surrounding means those who are well-wisher. We have to find out it. And later on, lastly, the observations. So on the observations, A and B's case, when brought to you, first find it, when and how it appears by taking the case prima facie from the relative other. Obviously, this type of patient sometimes brought by their relatives, and if it comes alone, then you to try to evaluate it and just give counseling and just rest, and sometimes it get. So this is the case one. It has been mentioned by the Dunham in the paragraph 5. The Shakes, another case is the epilepsy from convulsion. Epilepsy from convulsion. That epileptic from convulsion and that medicine, yes, that epileptic, what is the cause of the epileptic? The cause, you know that what are the causes of the convulsion of the epilepsy already have studied from the practitioner medicine. Obviously, the nervous center somehow affected. That nervous centers might be from the peripheral to central, or central systems, central nervous system might be affected due to some others. And some there must be some irritations. The patient has been suffering from since long. The modifications of the vital organs you have to, and after case taking, you have given some medicines on others. After case taking, it is revealed after taking. Doctor, मैं बचपन से मैं यंग जब एज था, एक मेरे गन शॉट इंजुरी हुआ था, लेग में और पॉप्लिटियल फोसा में, बैक साइड में कोई गोली कर दिया, मेरे पाँव में लग गया, गन शॉट इन द थाई. So 1 year and 2 years I was okay, but after that epilepsy from convulsion, I consulted so many doctors, have given so many medicines, depressive medicine and others, but no, that convulsion is coming out. That convulsion coming out on examination of the case, when he got into, first what happened? First, epilepsy from nature of epilepsy and other symptoms, we give any other medicines. But you have to explore the actual cause, the explain own case taking from, नहीं डॉक्टर साहब मैं ये मुझे पास्ट हिस्ट्री में हुआ था, जो पास्ट हिस्ट्री में हुआ था तुम उनको रिवील करने होगा. देखो वो कब से वो हुआ है, वो क्या मिला ना, वहां पे गन शॉट इंजुरी मिल गया, इंजुरी था. And again you did MRI and others of that particular areas and find there is some foreign bodies inside still remaining the particles of the bullets and others, and that metallic are irritating it and producing convulsions. Then what to do? Again surgery. You have to refer the case to the surgery. Because of that, if a manual surgery is required, and manual surgery, you have to remove that pellets or the remnants of that bullets. And after that, doctor, after removal of such, last seen 1 month, I did not get any type of troubles in the form of epilepsy. So this is the obstacles. That obstacles in the form of sometimes does not require a medicine. You have applied a lot of medicine. Obviously, this type of patient will come to you after taking allopathic medicine and other medicines after a long time. And even homeopathy will consult that, but did not get relief. But after observations, that gunshot injury, so in such, you have to discriminate that proximate causes. That proximate cause, after the case analysis has been find the gunshot injury. That one, this is the one of the case. That another case 2, he has mentioned in the paragraph number 7, 6 and 7. Paragraph number 6 and 7 he has mentioned replies in this case. I've just given the brief of it. Case 3, a 2.5-year child subject to the epileptic from convulsions. उन्होंने क्या बताया, जे एक 2 साल का 2.5 साल का वहां पे आया है. After careful investigations, तो बच्चा तो बात तो नहीं कर सकता है, ज्यादा नहीं बात कर सकता है. तो यू सर्च अबाउट द फूड्स. क्या क्या उनको खाना देता है? फूड्स. The cause that irritation might be from such that organs that due to might be due to improper food convulsion उनको हो रहा है. I shall go. Doctor, I'm giving nothing but molasses only molasses. Molasses cake. How do you make molasses cake? कैसे बनता है? The 3 cups of flour and half 1 of butter and 1 of milk and 1 of molasses, 1 egg and teaspoonful of polish. This is very bad for the child. Now, stop it. Food se hua hai. To stop it and advise some foods, and that foods except just if food give in sugar or milk, plain sugar or milk for 1 day or 2 days. That plain sugar or milk, it is lactose, disaccharide. And you give same sugar or milk. From the milk it is produced, the lactose, that it is used as a placebo for the dispensing of the medicine, and sometimes it is also used as a food, because the lactose disaccharides, not the polysaccharide, starch, food, molasses, or not the monosaccharide, sucrose, but the disaccharide. The disaccharide is also, because it is lactose, it is having some nutritious value for the child. And after application of the disaccharides for 1 day or 2 days, there is no convulsion at all. And thereafter, you advise him such type of foods that is easily palatable, do not produce any irritation on the gastric region. Do not produce any irritation in gastric region. So just for 1 week, you will observe it. There is no question of recurrence of the epilepsy of that child, 2.5-year child, after correction of the foods. You have applied so many medicines. The patient has been brought to you not directly. When you will taking the case, the patient may come directly, patient may come indirectly. Obviously, these patients will come to you indirectly after consulting so many doctors in the form of allopathy and in the form of homeopathy. Obviously, you have to find out, or you have to ask the patient which doctor you consult, allopathy or homeopathy. And in such cases, obviously, 2.5 years past and prima facie people are very conscious, will consult homeopathic people. हम तो होम्योपैथी से दवाई खाया है लेकिन कुछ फायदा नहीं हुआ. आपका पास आया है, आप अंतर्भारती से BHMS पास किया, अच्छा कॉलेज है, ग्रेजुएशन कोर्स किया है, तो आपका पास आया है. तो सारा तो actually homeopathic doctors are very much cautious about the prescription. Do not export the prescription. If there is no प्रिस्क्रिप्शन से अच्छा से नहीं लिखता है, वो अपना से चेंबर से दवाई दे देता है. सर क्या दवाई देता नहीं, हम तो नहीं जानता है. Obviously, they will give some medicines on the basis of epilepsy, on the basis of prima facie. Did not explore, find out the cause in the form of asking the questions. क्या खाना दिया है, क्या खाना दिया है, खाना आप ठीक कर दो. हाँ, देखो वो उनको वो मोलासिस बंद कर दो, disaccharide दो, को plain easily palatable digest, will not produce any irritation in the form of food in the gastric system. So in this knowledge, you have to get that hygiene in the form of food, that in the form of food, that in the aphorism 77, that elements, one word is used, elements. What do you mean by elements? Aphorism 77, if you open, will that you will find that inappropriately named chronic disease. Those diseases are inappropriately named chronic. Those diseases inappropriately chronic, which persons incur, which expose themselves, contain and avoidable noxious influences. देखो avoidable noxious influences, avoidable ये जो word है इटैलिक लेटर में लिखा है, in organon medicine, bold letter and italic letter are very important. Italic letters, जैसे aphorism number 1 में italic letter कौन सा word है? Only. It is very important for us. It needs interpretation. इसको interpretation. तो ऑर्गेनन में जहां पे इटैलिक लेटर में कोई शब्द है, कोई वर्ड है, इसको इनर मीनिंग है, देयरफॉर एंड बोल्ड का भी इनर मीनिंग है, ये तुमको आइडेंटिफाई करने चाहिए। यहाँ पे अवॉइडेबल नॉक्सस निकले, ये अवॉइड कर सकता है, जैसे हु आर इन द हैबिट ऑफ इंडल्जिंग इंजूरियस लिकर्स और एलिमेंट्स, इंजूरियस लिकर्स और एलिमेंट्स। ये एलिमेंट्स का मीनिंग क्या है? नॉट एलिमेंट्स, एलिमेंट्स मीन्स फूड, एलिमेंट्री कैनल, एलिमेंट्री कैनल से वो एलिमेंट्स है, दैट मीन फूड्स। ये फूड समटाइम्स गैस्ट्रिक इरिटेशन करता है, क्रॉनिक डिजीज तैयार करता है, इसको हटा दो, करेक्ट हो जाएगा। एक केस नंबर 3 में डनहम साहब अच्छा से लेक्चर दिया है, वहां पे बताया क्लियर डिस्क्रिप्शंस। सो एलिमेंट्स, द फूड्स। डॉक्टर साहब देखिए ना, मेरे कुछ नहीं था, हम गांव से आया अंतर्भारतीय होम्योपैथिक मेडिकल कॉलेज से, लेकिन कुछ दिन से हमारा देखिए ना, ये कब से हुआ है, ये ट्रैवल मेरे हुआ है, अच्छा नहीं लगता है, नींद नहीं होता है, टट्टी से सफाई नहीं होता है, एसिडिटी होता है, कब से हुआ है? डॉक्टर साहब देखिए तो 1 महीने 2 महीने हो गया, 1 महीने 2 महीने हो गया, कोई दवाई तो हम तो आउटडोर में ले लिया है, तो कुछ फायदा नहीं हुआ है। तो तुम तो फाइनल ईयर स्टूडेंट, नॉलेज है तुम्हारा। देखिए मैं गांव में था और यहाँ पे आके मेरे खाना का कुछ प्रॉब्लम हो रहा है। कैसे? मेस तुम्हारा जो है तो वहां पे तो कॉमन नहीं मेस से हम कभी बाहर में रेगुलर अच्छा खाना मिलता है नागपुर में, गांव में ऐसे नहीं मिलता है। तो खाना क्या खाना खाता है? देखिए वो जो जंक फूड सर, मैं कभी स्विगी से ऑर्डर दे देता है, वो जंक फूड खा लेता है, रेगुलर रेगुलर है, मेरे हैबिट है। कैसे क्या खाता है? अभी चाइनीज फूड वेरी पॉपुलर हो गया ऑल ओवर द इंडिया, है, चाइना का फूड यहाँ पे आ गया, तो चाइनीज फूड भी कभी खा लेता है। तो ये जो ये है, ये अवॉइड कर सकता है। रेगुलर खाएगा तो आपको कोई क्रॉनिक डिजीज होगा, जब तुम स्टॉप कर देगा, देखो तुम अच्छा है। डॉक्टर साहब मुझ कुछ नहीं था, ये हम गांव से आया है, नागपुर में हॉस्टल में रहता है, कोई कॉलेज का तो हॉस्टल नहीं है, लेडीज हॉस्टल है, लेडीज हॉस्टल में रहता है, और दूसरा हॉस्टल में वहां पे तो देखिए, हेलो, एनीथिंग, मे आई कंटिन्यू? कब से हुआ है ना डॉक्टर साहब, क्या बताओ आपको, यहाँ पे पानी अच्छा नहीं लगता है, पानी अच्छा नहीं है। कहाँ पानी पीता है सब लोग? देखिए हम तो गांव में जो तालाब का वो हमारे अच्छा वेल था, फिल्टर भी होता है, यहाँ पे तो वो स्थिति नहीं है। सभी को ये टट्टी अच्छा नहीं होता है, लूज मोशन हो रहा है, तो लूज मोशन हो रहा है। देखिए आउटडोर में तो बहुत दवा लिया है, लेकिन कुछ फायदा नहीं हुआ है। तो यू हैव टू फाइंड आउट एनी एरर्स, that errors are to be corrected. That error in the form of hygiene, that error in the form of anything that might produce some troubles that was not happened earlier, just after coming into change of weather, change of places, change of water and others. जब तुम उनको एडवाइस करने का काम करो, तुम जो जहाँ पे पानी डिस्ट्रीब्यूट होता है, जहाँ पानी पीता है सब लोग, वो पानी को तुम बॉयल करके पियो और दूसरा का पानी पी को वहां के बोलो, तो मेस को लोग को बताओ जो वो पानी तुम हमारा कोई एक्वागार्ड और प्यूरिफायर से दे दो। देखो जब तक वो करेक्ट करेगा तुमको स्टूल भी ठीक हो जाएगा। तुम दवाई दे रहा है, यू आर गिविंग मेडिसिन, एलो, मार्क्सोल, Pulsatilla, Nasvomica, what are the symptoms you are giving the medicine? But in spite of the patient is not getting relief, then you have to think of the something, it is obstacles, that hygiene. If you remove that obstacles, just in these cases, कैरोल डहना में एग्जांपल्स इन बच्चा को जो 2.5 साल का जो बच्चे को दिया है, क्या है, उनको फूड करेक्ट कर दिया, मोलासेस बंद कर दिया, तो जो मोलासेस केक बनाया उनको बंद कर दिया, ठीक हो गया, कन्वर्सन ठीक हो गया। तो यहाँ पे तुम्हारा क्या हो सकता है, वो सब ठीक कर दो, देखो ऑटोमेटिकली तुम्हारा वो ठीक हो जाएगा, ऑटोमेटिकली तो तुम्हारा ठीक हो जाएगा। ये तुमको ध्यान देने चाहिए, ये तुमको स्थिति को ध्यान देने चाहिए। तो डाइट इन द फॉर्म ऑफ वाटर्स, फूड्स, दैट वाटर तुमको ठीक करने चाहिए, ये automatically the patient will get relief. So these are the hygienic causes. That means the things which causes disease and how to remove person's ill health, community based approach, approach 4 में बताया कि डनहम इसी तरीके से वो 6 एग्जाम्पल दिया है। तो इस 6 एग्जाम्पल कहाँ पे है, वो पैराग्राफ नंबर 8 में है, फर्स्ट चैप्टर का पैराग्राफ नंबर 8 में है। नेक्स्ट एग्जाम्पल कौन सा दिया, a lady patient with emaciation. That lady patient in emaciation, patient is telling the lady patient, doctor, since last few months I am becoming emaciated and weak. Before that my health was very good, very vast and robust. If you're a regular patient, sometimes your family patient, you are the family physician, so why you are emaciating? पहले तुम्हारा तो अच्छा है, हम तुमको दवाई दिया, लेकिन डॉक्टर साहब देखिए मेरे डिस्टर्ब स्लीप अच्छा नहीं होता है, नींद भी चला गया, रात में मेरे नाइट स्वेट होता है, बहुत मैं आई एम समटाइम्स आई पासेस लूज टूल, फ्रीक्वेंट डीप इंस्पिरेशन, हम सांस ऐसे ऐसे लेता है, आई एम वेरी मच फैटिग, आई कैन वॉक एंड कैन मूव, इवन आई डू नॉट राइड इन द अपस्टेयर्स, वेरी वेरी डिफिकल्ट फॉर मी। And after careful examinations, he find that he is getting trouble during 3 months. He is getting trouble from the 3 months, and because of that, after delivery, and because now the baby is sucking. तो डॉक्टर साहब देखिए ना, ये जो फर्स्ट इशू है, बेबी इज सकिंग एंड हम तो बहुत दुबला हो गया, खाना तो अच्छा खाता है, देयर इज नो प्रॉब्लम फ्रॉम माय फैमिली साइड, सास भी अच्छा खाना मुझे खिलाता है, सास तो देता लेकिन हमारा तो कुछ नहीं, प्रोडायरिया भी हो जाता है, कैसे होता है? ऑन इंक्वायरी तो 3 महीने हुआ है, बच्चा के सकलिंग कर रहा है, फीडिंग हो रहा है, ब्रेस्ट फीडिंग में यस, मेरे डॉक्टर साहब मेरे मिल्क बहुत अच्छा है, ब्रेस्ट मिल्क बहुत अच्छा है, मैं कुछ दवाई कुछ लेता है, कुछ नहीं खाता है, लेकिन बहुत ज्यादा है। तो पैथोलॉजी नॉलेज में देखो तो वो मिल्क को थोड़ा इन्वेस्टिगेशन करो, माइक्रोस्कोपिक इन्वेस्टिगेशन करो, तो मिल्क को माइक्रोस्कोपी इन्वेस्टिगेशन करके देखा, वहां पे sapient about of fatty matters, oily matters. Milk, as she has been passing abundant amount of milk during suckling, the baby get tired of getting suckling, but that is huge fats are there, and owing to that patient is getting weak. It is ordered appetite, and again what happened, the patient को बंद कर दो, अभी उनको बंद कर दो, बंद करके उनको दूसरा बॉटल फीड अलाउ करो, कुछ अलाउ करके 3 महीना हो गया, 4 महीना हो गया, धीरे धीरे उनको तुम कोई गोट्स का फीड दो, गोट्स का मिल्क दो, कोई काऊ का मिल्क दो, गांव में गोट्स का भी देता है, हाई प्रोटीन रहता है, काऊ का दो, ऐसे ऐसे उनको हैबिट करो, तुम्हारा ब्रेस्ट मिल्क बंद कर दो, यहाँ पे तुमको दुबला हो जाएगा, मर जाएगा, देखो तुम्हारा वो जो ब्रेस्ट का मिल्क मिला है, उनको बहुत फैटी मैटर्स तुम्हारा हेल्थ से चला गया, बॉडी से जा रहा है। सो यही नॉलेज से ऐसे रेगुलर, ये वेरी क्रिटिकल इश्यूज These are to be find out. दवाई तो डॉक्टर से बहुत खाया है, एलोपैथी भी दे दिया है, होम्योपैथी डॉक्टर को दिखाया है, बड़ा बड़ा डॉक्टर के, लेकिन आपका नाम सुना है, आप यंग डॉक्टर है, इसका नॉलेज आपका है, सुना अच्छा है, थियोरिटिकल अभी अच्छा साउंड नॉलेज है, तो आपको मैं देखा, तो इसका कोई ध्यान नहीं देता है। हाँ, ये ध्यान जब देगा, ये हिस्ट्री में लेगा, उसको बाद देखेगा, जो उनको स्टॉप कर देगा, जहाँ abundant amount of milk passes through the breast and breast suckling the babies and such, baby gets fat, but amount, such amount, huge amount, and baby, in spite of that, baby खाने के बाद भी बहुत ऐसे ऐसे निकल जाता है ब्रेस्ट मिल्क, तो उनको टेस्ट करके देखा, फैटी मैटर्स है, बंद कर दो, उनको दूसरा फूड, आर्टिफिशियल फूड चालू करो, वो और एनिमल मिल्क को चालू करो, देखो धीरे 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 उनको चारा ठीक हो जाएगा, हेल्थ ठीक हो जाएगा। ये जो इशू है, ये तुमको अच्छा से धीरे से नॉलेजेबल जो होगा वही कर सकता है। ये केस नंबर 4 उन्होंने दिया है पैराग्राफ नंबर 9 में, ये थोड़ा ध्यान दीजिए। तो यहाँ पे हाइजीनिक कॉज है, यहाँ पे हाइजीनिक कॉज है, देयरफॉर ये यहाँ पे थेराप्यूटिक का कोई जरूरत, बहुत थेराप्यूटिक एप्लीकेशन किया, दूसरे डॉक्टर कुछ फायदा नहीं हुआ, लेकिन तुमको जो एडवाइस दिया है, ऐसे तुमको नॉलेज रखने चाहिए। नेक्स्ट केस नंबर 5, a patient with facial neuralgia with exhaustion, similar case, facial neuralgia, similar case, patient बहुत इसको क्या हुआ, ड्यूरिंग द इवनिंग पीरियड, पहले नहीं था, सिमिलर एग्जॉशन, फेशियल न्यूरल्जिया, रेगुलरली इंटरमिटिंग कैरेक्टर, फेशियल न्यूरल्जिया स्टार्ट हो गया, patient meanwhile declining rapidly in strength and until medicine being perhaps altogether discarded, बहुत सारा medicine दिया है, patient induced wind are in pain and thereby unable to take hearty food, and strain and face returns and neuralgic pain ceases, जब वो बंद कर दिया, winning बंद कर दिया, वो regular हो गया। In this case also restoration accelerated by judicious recourse of the therapeutics, but there are two therapeutic must be subordinate to hygiene, पहले बंद करने पड़ेगा, बाद में तुमको दवाई दो, ठीक हो जाएगा। तो पहले कभी कभी तुमको दवाई की जरूरत नहीं होता है, मेडिसिन की जरूरत नहीं होता है, ये तुमको केस चेकिंग करने बाद ये तुमको रिवील करने पड़ेगा अपना नॉलेज से, तुमको पैथोलॉजी नॉलेज नहीं रहेगा, तो फिजियोलॉजी नॉलेज नहीं रहेगा, कम्युनिटी की मेडिसिन नॉलेज नहीं रहेगा, तो उसको क्या करेगा, पहले से दवाई दे देगा, कुछ फायदा नहीं होगा, पेशेंट का पेशेंट फिजिशियन का बदनाम हो जाएगा, होम्योपैथी का रेपुटेशन खराब हो जाएगा, अंतर्भारती का रेपुटेशन खराब हो जाएगा, ये तुमको ध्यान देने चाहिए। केस नंबर 5 उन्होंने डिस्कस किया है, paragraph number 10, you please go through this one by one. Case number 6, patient with depraved nutrition with burning pain under right scapula. डॉक्टर साहब मेरे ये जो यहाँ, तो यहाँ पे बहुत पेन है, देखिए ना, बहुत बर्निंग है, जलन करता है, कब से हो रहा है, पेशेंट रिली बर्निंग, अनलेस फिजिशियन नॉलेज ऑफ पैथोलॉजी, जब तुमको नॉलेज नहीं होगा कैसे हो सकता है। यहाँ पे क्या हुआ है, देखिए डॉक्टर साहब, मेरे ये तो नागपुर के आने के बाद मेरे तो गांव में प्ले होता है, बहुत गांव में क्रिकेट प्ले होता है, फुटबॉल होता है, कबड्डी होता है, लेकिन ये नागपुर के आने वाले पढ़ाई करो और लाइब्रेरी जाओ और टाइम नहीं भरे, तो ये जो पेन होता है तुमको आइडेंटिफाई करने पड़ेगा, ये कब से हुआ है, कैसे हुआ है। जब उनको बताया गया लिफ्टिंग से हुआ है, कुछ भारी चीज, वेटी चीज में लिफ्ट किया है, वो अलग चीज है, लेकिन इसको ऐसे कुछ देखा है जो वो उनको कोई ये जो निडल लाइक सेंसेशन पेन हो रहा है, बिकॉज ऑफ दैट ही इज staying at a closed room at Nagpur, any areas, or patient staying at like that, there is no question of air, question of exercise, question of getting open air. So after regular checking this one, we find that case number 6, that nutrition, patient with depraved nutrition and even the right scapular pain will correct by correcting that. So in this case, first time we'll think of that, the causation of lifting and others, and that might be rastux, that might be ruta. Obviously, you will picture it, but you did not correct these hygienic procedures in the form of open air, in the form of exercise, in the form of any other thing required for the body studies others. So when you will correct it, the patient will automatically get pain. Even in spite of medicine, जितना तुम दवाई दो, रास्टक्स दो, और जितना दो, तुमको कुछ फायदा नहीं होगा, Now case number 7. The case number 7, that case number 6 he has mentioned in the paragraph number 11. We purchase or procure, obtain the book, we make it Xerox and keep it side paragraphs and others. And please, what I am telling you, you just justify and verify with the books what is written. I am taking the brief studies. In the page number 7, he has mentioned in the similar things, the coldness of the extremities. कोई doctor में आया है क्या है? Now the patient is severe darting and aching pain of the shin boy. कोई businessman है. तो businessman क्या बताया डॉक्टर साहब, देखिए ना, मेरे जो business है, मैं तो वहां पे काम करता है, मेरे डार्टिंग एंड पेन हुआ है, बहुत दवाई खा, होम्योपैथी दवाई खा. तो मैं उन्हें इंक्वायरी फाइंड आउट, तो क्या देखा है, जहाँ पे उनको जो बिजनेस प्लेस है, जहाँ पे उनको दुकान है और एनी अदर थिंग्स, कमर्शियल एरियाज, दैट इज वेरी डैम प्लेस. That is the soils are, floor is very damp one. So in this case, you have to advise him, please change the place. Please change the place. You are given Rastux, no effect. Even given Calcarea cup, no effect. Even given Natron salt, no effect. Until and unless you correct it in the form of proper places. Please, आपका बिजनेस जहाँ पे है रहने दीजिए, लेकिन वो जो आपको जो है वो बहुत एरिया बहुत डैम है, ये प्लेस आपको रिमूव करने होगा. वो आप जब वहां पे जाएगा, सॉक्स पे सॉक्स पिन के जाएगा, हाँ वहां पे, और ऑलवेज यू वेयर द शूज एंड सैंडल्स एंड अदर्स एट दैट एरिया. डोंट स्टे देयर विद योर एम्प्टी पाँव में नहीं रह सकता है, पिन के वहां पे जाओ. तो ये तुमको नॉलेज देने पड़ेगा. A case number 7 का beautifully has explained and in this cases. So ये जो नॉलेज है, देखिए यहाँ पे तो पहले तुम्हारा जो सीनियर दादा लोग आउटडोर में वो रास्टक्स दे दिया, बहुत सारा दवाई दे दिया, बैड इफेक्ट्स ऑफ डैम रेपार्टरी देख के दे दिया, लेकिन फायदा नहीं हुआ है. ये सर्च करना पड़ेगा तुमको, ये हिस्ट्री लेने पड़ेगा. इतना दवाई दिया, प्रिंसिपल सर दिया, लेकिन काम नहीं हुआ क्या? प्रिंसिपल से इजी बिजी पर्सन है, he did not find out or did not explore out that cause that might be due to the damp place, and the patient is always remaining in the constant for a few hours and the damp place for his interest of business, did not find out. ये हो सकता है, कभी कभी फील कर सकता है, याद में नहीं रहता है. तो ये तुमको जो है, ये डैम प्लेस को हटा दो. तुम तो हटा नहीं सकते, बिजनेस तो बंद हो जाएगा. एडवाइस करो, तुम थोड़ा ऊंचा जाएगा में रहो एटलीस्ट. एंड समटाइम्स after 1 hour or 2 hours, go to the open air, go to the sun for vitamin D and others, natural and exposures of the vitamin D sometimes. Don't give the supplementary one, some advice and patient data benefits. So, ये जो हमारा कैरोल डहाम का जो ऑब्जेक्ट है, जो हाइजीन का जो इम्पोर्टेंट है, एफोरिज्म 4 का जो इम्पोर्टेंट है, पहले हनीमैन साहब एफोरिज्म 3 का बाद ही एफोरिज्म 4 बता दिया. तो ये है हमारा, तुम्हारा क्लास है लगता है 11 एफोरिज्म पैराग्राफ 11 एंड पैराग्राफ 12 में बताया, क्लियर बताया. तुमको नॉलेज ऑफ फिजियोलॉजी चाहिएगा, नॉलेज ऑफ pathology, knowledge of hygiene, all the subject will come into play in clinical practice in therapeutics, even the toxicology, even that means forensic medicines. And legal procedures and state forensic medicine are very much necessary for the practicing. कैसे तुम prescription करेगा, what is the legality and ethics and morality has very much importance. So all the subject will come into play into your practice during internship or post-internship course. That is the practice life. So my students, so this is the first topic. And next day, I will discuss on the limits, nature and limits of the science of hygiene and therapeutics. Every subject has some scope and limitations. Whether it is homeopathy, whether it is allopathy, whether it is a surgery. So next day, we will discuss on that point, that point, so how it come into play, that's one I will discuss next day. Okay. Thank you, students.